Hi, I'm Jordan Cravens, a reporter here at the Courier. I'm joined today by Precia Stuby, Director of the Hancock County Alcohol, Drug Addiction and Mental Health Services Board, and also John Stanovich, Assistant Dean of the University of Findlay's College of Pharmacy. We're here today to talk about kind of a continuation of the Addiction Among Us series, but also to talk about a new task force community leaders have launched to help with the problem. John is leading the group, and if you want to maybe tell us a little bit about the task force and what its goals are.
The task force has been put together to address a problem within the community, not just within the Hancock County community, but also it's a national problem with prescription drug abuse, specifically looking at primarily controlled substances. And the problems and issues that they're presenting for this community as it pertains to substance abuse among our adolescent population. The task force is being designed to encompass a number of different people from the community, different leaders from the community, to look at this not just from one perspective, but to look at it from a lot of different perspectives in order to help us address this issue. And maybe, Precia, maybe you'd like to give more specifics in regards to the different committees and subcommittees.
Yes, essentially what we're trying to do is see what we can do to curtail the problem from growing any more than it already exists, with the ultimate goal of reducing the problem. We've identified 4 areas and have selected chairs of each of the 4 committees. The first is the medication collection, which you're aware we've already had 3 medication collection days in the community. We have 2 more scheduled, but we want a committee to help us extend the awareness of that and get more people to participate, as well as share with people what they can do in between the medication collection days to keep medication safe and out of the hands of people that would be using it inappropriately. We have one committee that we want to have focus on having a toolkit developed for schools. So we want them to look at curriculum that's available that can be brought into the schools, and or information that teachers can incorporate in their own curriculum, so for all different age groups. So we have an education committee putting that together so that the information can go to the schools versus them having to look into the issue and develop that. We have a third committee which is really focused on education of the medical community. So, and a broad use of the term medical communities, from doctors, nurses, emergency room, home health, hospice, anybody that really is interacting with individuals who are taking medications, to talk with them about what's happening, what they can do to help, again, people understand the necessity of, keeping control over the medication that they have, knowing the dangers, and so on. And then the fourth area is just a general community awareness, where we want to make sure people are in general aware so that we can all, again, continue to look out for one another. And if we see something that looks different, or we want to encourage people to get into treatment and so on, we have a way of doing that. And that committee will also be putting together a reporting mechanism that we want to use, because at this juncture in our community, we may say, for example, that we've had 2 individuals who have had a tragic death as a result of an overdose. So some may say, well, that's just 2 people. That doesn't seem like a big problem in the community. Well, when you add to that, someone saying, well, we've had a number of babies born at the hospital that are drug addicted. And then you add to that from the police department or the sheriff, what's happening in terms of collection of medication and charges and that kind of thing. You begin to build a picture that says, gee, this problem is creeping up in all different aspects. So what we want to do is identify a way where we can have a repository for people to put that information in that they're already collecting, so that we can get a big picture look at what's happening in the community, and then sustain that database over time so we can measure the impact that we're having as a task force.
Mm-hmm. Now, for viewers, can you define, you say that we have a problem here in Findlay, understanding that it's not unique to Hancock County or Findlay or even Northwest Ohio, but the whole country. What is this problem? Can we nail it down what it is?
Well, I guess the most compelling way I can say that is that in Ohio, we have more people dying from accidental overdose than car accidents. Now, that's the first time in the history of Ohio that has occurred. Again, as John mentioned, this is happening nationally. Ohio is not unique in that situation. Primarily, the issue is the abuse of prescription drug medication, and when in opiates in particular, and then when individuals are no longer getting it as prescribed and they need it, then they're turning to the drug market to get it, and when they can't afford the prescription pills, then they turn to heroin, which is also considered an opiate, but not a legal medication, obviously. And so it has resulted in a big surgence of increased use of heroin across the state. So prescription medication is actually like a gateway problem to the heroin.
From the treatment side of things, you work with some of the service providers. What are they telling you? I mean, is this something that's affecting all ages? I mean, are they inundated with calls for help, or what is the situation out there?
Well, I do want to keep the issue in perspective. From the resources available to our board, we subsidize treatment for about 700 to 750 individuals a year. What we're seeing in terms of people coming in with opiate addiction is in the 50 to 60 a year coming in for that. So the predominant problem is still alcohol dependence and other drug. However, where heroin would be like that rare word that you would not hear, and maybe you would have somebody come for services, 1 or 2 clients a year, to go from that to 50, 55, 60, it is like, really an acceleration at a very high pace. Now, statistically, when you look at the national statistics in terms of what's happening, the prescription drug abuse is happening across all age groups, but its most sharpest increases are in the younger population. So, you see steep increases when you get to that, that 18 to 30 is where you see, more people using it more frequently.
Understand with this task force, you guys are going to be having kind of a kickoff organizational meeting, and that's what's the date of that?
August the 12th.
August.
No, that's
August,
not August the 10th.
August the
10th.
10th from 6 to 8, and that's
Right.
out at the
Yes.
that's going to be out at the university.
Yes.
Tell us a little bit about what that meeting's going to be like.
Well, essentially, we're doing it like a town hall meeting. It's open to anyone and everyone that would like to attend. We're going to take the first portion of the evening just to on general awareness, explain the problem, how prevalent it is, what the issues are related to it, and then we're going to go from there and talk about setting up the task force and the different committees and what the purpose of each committee is, introduce the chairs of each of the committees, and then give people an opportunity to sign up to be a participant with one of the committees if they want to help that way. And then we'll just have an open dialogue for people to ask questions in an open forum format.
Yes, this is a community problem that needs a community of people to address this issue and to help us in regards to curtailing the abuse of prescription medication. So it's healthcare professionals, it's individuals from education, it's individuals from all facets of the community who need to come together and help us in this effort to try and address this issue.